the Top Doc channel. I'm Dr. Zach along with Dr. Dave. There's two doctors sitting here, one of which likes to play doctor on the radio and one who is an actual medical doctor. I have a PhD, which means it's piled high and deep. It does no good for anybody. I can't revive anybody. I can't administer drugs to anybody legally. There's not much I can do, but you can do a whole bunch. And I think it's really interesting that you're the only urologist with his own stream. Bravo.
Thank you.
Did you get that joke?
Yes,
Okay.
I got
Gotta
it.
have some jocularity.
I mean, not only my own stream, but a good stream.
Yes.
It cannot just be a regular stream.
A
with
strong
urologist.
stream.
Strong stream.
Oh, before I do these, I got these various products over here, and they always say ask a physician before you use them. So I got a whole bunch of them, including my nuts, that you'll look over and you'll tell us whether it's fakakta or not, okay? Sure. All right, let's go through some of these products. It always says ask your physician's advice before using. This particular product is from Solgar. It's very good as far as I'm concerned. North Atlantic kelp. Now, as you well know, today we have salt that is no longer iodized, right? It's just sodium chloride. There's no iodine in it.
Sure.
And after I was out over by Santa Monica and I dipped my feet into the Pacific Ocean, I kept thinking to myself, Fukushima water! And that I was going to come out glowing from the radiation. It's probably already over there. So I started taking kelp one time a day. I want you to look this over. Tell me if it's fakakta or not.
Well, first of all, you know, big letter says dietary supplement, which, you know, that's a good telling sign. As soon as something says dietary supplement, it basically means that everything on the label, you know, has different rules on it. It's almost like you're buying an orange, you know.
Okay.
So they can make all kinds of claims on this, and of course, this bottle itself actually just says North Atlantic kelp. So not sure if it's farmed kelp, like where they found this kelp. So a lot of what is on this bottle is incomplete, and you're not even sure where it came from,
Right.
if it's polluted water.
You're just trusting the label.
So, and then, you know, when I open it, I just usually like to see how they've been able to, so they, you know.
It's not plastic. That's going to be gelatin of some type.
Yeah, there may be some gelatin or something, but then, you know, I try to open it
make a mess now.
to see what's going on inside.
Oh,
And,
boy.
you know, it's
All right.
basically, I mean, I don't know what they put in here, but it looks like ground up dust.
Okay.
So I would have to trust that there's something organic in this.
Well, I know a lot of rich people
but-
like this brand, so I guess
Well,
that's pretty good.
Well, as long as the brand is very expensive, then you know it's good.
That's
'Cause, like,
right.
the cheaper
Yes.
brands cannot be good.
What's
you
the
know
price
that.
on that?
$14.
That's expensive for that. How many capsules?
100 capsules, so it's you know, that's actually pretty good. That's 15 cents a
Okay,
capsule.
so you know that. All right, and
That-
the iodine. What does it actually do for your system?
So, you know, the iodine is a extra mineral that it was hard to get in our diets before. So, by putting iodine in salt, made it easier for people to have this mineral that's difficult. But I feel that with a lot of our salting techniques, we're overdosing in it now because there's a lot more salt available with iodine. And
Really?
you know, well, I mean, you know, it's hard to control how much
Okay.
iodine you then take. So I think it's in the general scheme of things, it's better not to put additional nonsense into salt and other products that you use.
Now I have my here's my nuts. It's
Yeah,
my
no, I
plantar
see
nuts.
that. I see that. There's plantar nuts, and you know, there are a couple of things about these nuts that I look at like
See,
right away.
See what I did there? I went from prostate to talking about my nuts. I got a doctor to talk about my nuts.
Well, you know, you have a good choice in nuts because Mr. Peanut is on the actual cover, and that must mean that the nuts are high quality because you wouldn't have a peanut endorse it unless it was really good peanuts.
Are you being sarcastic? I'm
Well,
sensing
you
sarcasm.
judge for yourself.
All right.
You judge
Well,
for yourself.
let's go over the nuts. And the reason why I bring this up, two different reasons.
Mm-hmm.
I've always heard that nuts are good for you, peanut butter is good for you. But then there's also this increase in peanut allergy, and I think it's got to do with the processing and possible GMOs that are causing a bad reaction.
You have a GMO in this right off the bat. I mean, it's
Okay.
corn syrup. So corn syrup is a GMO.
Yeah, that's bad for you.
Corn is genetically modified.
Hold on one second. Hey, Dave, can you get my other nuts over there? Because those are plain nuts, I only think they're salted nuts. So we
So-
got my salty nuts and we got the sweetened nuts.
Right. So on this, it actually only has. So I look at the ingredients because that's
Okay.
important, and the ingredients on this are peanuts, peanut oil, and sea salt. So these cocktail nuts are actually fairly healthy. These honey roasted peanuts are. They cannot be sold in Europe. Did you know that?
Oh,
These
no, I
peanuts
did not
cannot
know
be sold in
Throw the
Iceland
can
or
over here.
Europe or
Yeah.
Canada.
Here's basketball going on. Yes. Oh, I
Missed
missed.
it. Well. Anyway, these are actually good nuts. So the way you look at it, not just because they have a peanut there doesn't mean it's good or bad. It's actually what's inside the nuts that counts.
Right.
So you got to look in the nuts.
All right. You can open it up.
All right. Let's see. So
You smelling my nuts?
Now
Yeah.
I smell the nuts, and they actually look fairly healthy. Like, check this out. I mean, this looks like a real peanut.
All right, let's go to this next one. It is probably one of the most prescribed medicines in the history of humanity. And if they tried to get it through the FDA these days, I don't know if they would actually make it a legal drug, and that would be baby aspirin or aspirin.
Well, this is what I was gonna talk about. So
All
when
right.
you're talking about turmeric that's gonna decrease inflammation, we know that baby aspirin actually does decrease inflammation, and not only does it decrease inflammation, it also makes blood cells less clottable. So I'll give you my take on just humanity. Right? Is we evolved to be 40 years old, and that's basically it. If you go back just 100 years ago, people were not living past 40. The average life expectancy just 100 years ago was 40, basically.
Yeah, you're
and
right.
almost
Yeah.
if you're looking at it worldwide, and in America it was less than 50. So even kind of a fairly clean, healthy, prominent country was still dying at very early ages. So our bodies work great up until about 40 or 50. At around 40 or 50, our warranty runs out. So like it's buying a car or I buy an Apple iMac, and about 3.5 years in, it breaks, because I have a 3-year Apple Care. So about 3 to 4 months after the Apple Care expires, somehow it breaks, which is kind of standard. It's very similar to what happens to our bodies. After our warranty expires, when you buy a fresh new car, it works well up until that warranty. Warranty period expires, everything starts breaking down. Yeah. It's very similar to that. Now we see a mechanic often. Before we never used to see a mechanic when we have a new car. Now we got a 5-6-year-old car, you go to the mechanic all the time. So baby aspirin is our mechanic basically, without in a pill form. So it's better than most doctors because it stops inflammation and it stops blood clots from happening before they happen.
So this is something that should be in the daily repertoire.
I think after your
most
age of
Americans.
50, I think after the age of 50, I don't see any negative in taking a baby aspirin. It doesn't increase your risk of bleeding, but it makes the chance of stroke and
Reduces
and
it. Okay.
and heart disease a lot
What's
lower.
your website?
Well, it's NY Urology, which is easy to
It's
remember.
easy to spell.
Yeah, and fairly easy to spell.
Yeah.
Although it's not, people think it may be NYU Urology, but no, I'm
No.
not affiliated with NYU. I'm NY Urology, so
Right. Okay.
it's just NY and Urology.
And let's face it, if you see your doctor on a regular basis, and after a couple of years he gets to know you, if you have a problem, chances are he'll go, "All right, I'll see you later on this afternoon." You fit people in that you know.
Well, I could tell you that I make a pledge to a lot of my patients that if you come see me on a regular basis, your chances of having anything bad from a urologic perspective goes down to less than 1%.
That's really, that's nice. That's I want to tell you, I really honor that you're like that with your patients. It
Well,
matters.
I mean, I think the goal really is when you go to a doctor, they got to tell you the truth and either be reassuring or tell people the way it is so that they're aware of any issues or limitations they may have. So I try to give patients like the 360 view of, okay, this is what's coming down the turnpike. This is what we have to watch out for.
And here's the game plan.
Right.
Yeah.
And again, and game plans change every year. So that's why we do some, appropriate testing when people come in and we check out what's going on with them.
Yeah.
Broadcasting from the Rock and Roll Bomb Shelter.
I'm ready.
Surrounded surrounded by radioactive biscuits and the world-famous rock hives located 40 feet beneath the radio station. It's the Big Fat American Rock Show with your host, the Doc of Rock, the Professor, everyone's favorite mad music magician, crazy uncle, and your best friend in the whole wide world, Zach Martin.